Long COVID does not mean that you are disabled like some of us, like myself, have become.
Mhm.
And don't compare yourself to other people. Yes, it can be devastating and disabling, but it may not be everything that I deal with.
Well, I'm excited to introduce you all to our guests on this podcast episode. I am joined by Brooke Keaton. So, Brooke, we've been chatting for a little while before I finally hit record. How are you doing today?
I'm well, like I told you before, just a little tired and achy, but that kind of comes along with having long COVID. So
Yeah,
I'm
yeah.
used to it.
Well, I'm glad you made some time to join me and to share a bit about your journey and yourself with our podcast audience. I will jump in. We're going to jump in because we have so much to chat about and so much to talk about. I want to know, this is going to be a little different than some of the ways that we typically follow in, like in my questions for the episode, but still kind of similar. So let's just kick off with an introduction. Why don't you tell everyone a little bit about yourself?
My name is Brooke Keaton. I am 44. I live in Charlotte, North Carolina. I'm married to my college sweetheart, and we have two daughters that are 14 and 6. The 6-year-old is really like 87. Background: prior to having long COVID, I was an educator. I also worked in social services for almost 12 years for Mecklenburg County prior to returning to education. I love to travel. I love to read. I love Hallmark movies. Yeah, I am. I am a tomboy, but that's my girly thing. I love Hallmark movies. I don't know. I'm just a. I've always just been a very just kind of bubbly, happy, fun loving, and just person that just I've always loved helping other people. So yeah, that's I think that.
Yes, that's such a great introduction, and I appreciate that. And I do, it's almost like embarrassing to say, but I do like Hallmark movies. The cheesier, the better. Like during the Christmas
Yes.
break, that was how I had some downtime. I wanted the every now and then, and I watched a lot of Christmas movies, which is saying a lot for me because I don't typically watch TV.
Yeah.
But during the break, that was one of the ways I wanted to be able to relax. So I got to pick out the movie, and
Well, that's good. Just quickly, a gift I gave to myself this year. Hallmark did a Hallmark Christmas experience in Kansas City. And so that was my gift to myself. So right before Christmas, I spent 3 days in Kansas City and I got to meet some of the actors and actresses and just pretend I was in a Hallmark town for 3 days.
that is so nice. I didn't know that was a thing. That
It
sounds
was
like
the
a lot of
first one.
fun.
I think after the success, because they did it 4 weekends in a row starting around Thanksgiving. So I think
Yeah.
it's a thing now. So I'm going back.
Yeah. Oh, that is so nice. And I love how could treat yourself. So that's really
Have
good.
to. You have to.
Yeah. Yeah. So we met, and I love the way that we met too, because we met we actually officially met at the APHA conference in Minneapolis. So
Right.
that's American Public Health Association's conference. It was in Minneapolis. Was that like the end of October?
Yeah.
And I recognized you. We actually sat a row behind you on the same flight. And then we got there, realized our booths, you're with an organization, and the booth was directly across from our booth.
Right.
So I was like, I saw you on the plane. And we started talking a little bit.
Yeah.
And I decided, because it was with, let's see, Long Hauler Advocacy Project.
Yeah, the COVID-19 long hauler advocacy project. Yeah.
And I thought, oh wow, I want to get to know more about the organization and what you're doing. And I just was getting to know you in the process. And so we exchanged information. And then at the end of the conference, we end up on the same
Same flight.
flight heading home. Found out that you're in Charlotte, North Carolina. I'm just outside of Columbia. So we're not that far apart
Mhm.
geographically. So we've had multiple conversations in between, and I'm excited to have you as a guest on the podcast. And I think one of my main reasons for wanting to do this was really awareness of long haulers and people that are suffering with long COVID, and to humanize the process and really hear a personal story. And your journey is it's heart wrenching, but it's also inspiring at the same time. And I'm so inspired by you. And I want our audience to get to know you and your story, and to also point to some organizations that we can pour into and support as public health community and industry to be able to make a difference here too. So, what I'd love to do on this podcast is kind of roll back a little bit. You talked a little bit about, the fact that you are suffering with long COVID and your background. But let's go back to a little bit at the beginning. You talk about social work and educator. But at what point did you first hear about or consider public health?
So public health, we kind of had a little discussion before, but out of college, I taught children with special needs, specifically an organization that worked with children with cerebral palsy. And then I did work in for social services in Mecklenburg County for almost 12 years. And we did a lot of work with like the health department, and we were always looking for different resources, and especially when working with children with special needs, you have to stay abreast of what's going on to try to keep them safe, keep their parents aware of, I mean, just even the smallest little outbreak that you will find in a small setting. Kids get pink eye, something like that could be detrimental for a child who is fighting off other illnesses and things like that. So I guess I've kind of, guess since I was about 20, 21 is when I learned about the importance of public health. And I've learned a lot more in the last 4 years.
Yeah, yeah, that's really interesting too. Prepared before you really knew that this was going to be so personal for you,
Right.
right? So, as an educator, did you have a specific topic that you taught, and how did you move from kind of social work to educator?
So what's funny is, so I'll go back. High school, I went to high school in Maryland, and in our county, you had to either be a college completer, where you had to be able to be accepted into the University of Maryland, or you had to be a career completer. So at the point of graduation, you were already gainfully employed or could be quickly become gainfully employed. I did both tracks, and what I did was early childhood education. So I actually started teaching in high school. We had a preschool on our campus for children in the community. And so the parents knew that we were students and we were learning, so they didn't pay as much, but we had a full preschool at
Wow.
my high school. And so I was thinking ahead, like, okay, well, let me do this so while I am in college, I can find a way to pay for school, or have extra money, things like that. So I went to school for psychology. I minored in sociology, and coming out of school, I knew I wasn't going to be able to go straight to grad school. So I went to work, and I started teaching again. I teaching special education, and then I went from the private setting into the school system, teaching special education. And I'll be honest, money was not there, sadly.
Yeah.
And I'm like, I have bills to pay. I
Right.
brought my brother, who was a teenager, down here to live with me. And I was like, this is just not enough. And so I was just looking at different areas where I had passion, and still felt like I would be helping
Hmm.
people, because ultimately that just is how I was. I guess that my DNA, how I was born, it's helping
Yeah.
others. And so I started working for social services
Okay.
in 2007. I want to say, yeah,
Yeah.
end of 2007.
Okay.
So, and then when I that teaching bug came back when I was on maternity leave with my youngest, because I'll be honest, social work is stressful.
Yeah.
Working in that environment is stressful, and I felt like I had done what I was supposed to do.
Hmm.
I was able to go back into education. I worked again in a private setting, and it was right before COVID really started. And so I was really working with children from 4 through school age, because we opened up where kids weren't, they couldn't go to school, but we had quite a few children whose parents were first responders in certain ways, doctors, police officers, just working in medical field in general. And so those children needed a place to go.
Yeah.
And so I was in a lot of different classrooms. Just yeah.
So when you I'm assuming, I know we talked about this. So when COVID started, and of course we were all just, everybody remembers having to trying to figure everything out real time. When did you first get COVID, and then at what point did you realize it was long COVID, that it was not COVID?
So I'm really what we call our COVID versary. I'm at that point, my 4 year COVID versary, actually, right now. I developed COVID at the end of 2020, the middle of December of 2020.
Okay.
I was sick with COVID probably 3 weeks. It took me about 3 weeks to say, okay, COVID is gone. I was no longer testing positive, but I immediately knew something was wrong. Like it immediately, I knew something was not right. I was having, and this would have been right here at the beginning of January that I started going, okay, I know COVID is gone, but I am like super fatigued. My heart rate is so high. Like it was my resting heart rate is in the 60s.
Mhm.
But at this point, resting was probably close to 130. So
Wow.
my heart is just constantly racing. When I stand up, I'm blacking out. Going downstairs, I'm losing my breath walking downstairs. I can't remember anything. So literally, it just kind of it came together. Some people with long COVID, they'll have the infection and then they'll start noticing something, months down the line. For me, it was immediate. I knew something wasn't right.
Yeah.
So around this time of January 2021, part of what was wrong, I didn't know I had pneumonia and didn't know.
Wow.
And so I had gone back to work right after the new year for maybe 2 days. And I told them, I said, something isn't right. And my doctor had me go, everything was so crazy. So even though I felt horrible, I had to go to an outside clinic
Mhm.
off of Uptown Charlotte. And they ran tests and everything and listened to me. And I was diagnosed with pneumonia. So it took me about 3, 4 weeks to get over that. But I still kept saying, yeah, something
Something's
isn't
not
right.
right. Yeah.
Something isn't right. So my physician at that time, I guess at this point, we're in February of 2021. She finally had I could come in because I wasn't experiencing COVID like symptoms or
Mhm.
pneumonia. So I was finally able to go into the office and we started looking into what was wrong. Oh, and then I have shortness of breath. I was diagnosed with asthma. I've never had that before. Yeah, so and then not long after that, she said, I think you have something called long COVID. What's well, not funny, I don't think any of it's funny. Ironic is my husband, because he knew all of the symptoms, he brought it to my attention probably the end of January and said, hey, Dr. Fauci's on TV and he's talking about this thing called long COVID. And babe, they're listing everything that you're talking about. And so when she said that, that wasn't the first time I'd heard it, but I still didn't know what
Yeah.
it was.
Yeah. Oh my goodness. So that was early, like spring 2022.
So at this point, we're the end, well, late winter, early spring of 2021. Or,
21, that's right. Okay.
uh-huh, yeah.
And so were you able to how did your doctor treat you?
Initially, she was I mean, she set aside a lot of time for us to talk about what was going on. She sent me to, a lung specialist. I had one heart echocardiogram. She sent me to
Mhm.
have like a echocardiogram, but she just really didn't know what to do with it.
Yeah.
She did treat me for anxiety, which yeah, I knew I was dealing with that, but I was like, there is some other things going on here. Like, what do we do?
Yeah.
And my frustration there was I didn't want to feel like I was being gaslit, for one,
Mhm.
because sadly, that's a lot of people are dealing with that. But as I reflect, I just really feel like she just didn't know what to do. And then some people can't say, I don't know.
Yeah.
So ultimately, I was unable to return to work, and I lost my insurance. That would have been the end of April of
Mhm.
2021. So I had to find new insurance, and when I did, I had to find new providers. And so my current provider, I'm a firm believer in things happening for a reason, because going
Mhm.
to her, she has been a godsend.
Wow.
So she sent me, when I finally saw her, she sent me to every specialist based on any of the symptoms that I told her that I was dealing with. And so at this point, I have a pretty amazing medical team. And I call them a team because they do work
Yeah.
together.
Yeah. Yeah. That's incredible. I hate that you've had to go through that. At
Thank
the
you.
same time, I'm so glad that you were able to have this team, develop
Yeah.
or create this team, have this team of support. And we're all figuring it out during that time as in real time, right?
Right, right.
Which is, definitely frustrating for, me to hear it, but for you experiencing it.
Yeah.
So even now, just to mark the time of the recording, we're at the beginning of 2025. I met you was, like I said, the end of October 2024, but I know that since we've been talking, you've learned to be very flexible, to navigate the days. Every day looks a little different.
It does.
What are
Yeah.
things like for you now in terms of symptoms and management of long COVID?
So, as much as I do not like having to take medication, I do have quite a few that I take. I developed a heart condition from COVID, so I have a heart medication that helps regulate my heart rate, because basically the condition I have, it's, in layman's terms, my heart's in a constant state of fight or flight.
Mm,
So, small things that may not even, you may notice, but it's not a big deal. My heart may react like somebody threw a rock through a window or something.
mhm,
And so I'm on a medication that helps with that. I do take medication for anxiety,
mhm.
because this has been and
Yeah,
continues to be a lot, to
yeah,
handle. And I do, and I tell people, like, I'm an open book. So
mhm,
I take medication for depression. I take medication for anxiety. I also was diagnosed with an autoimmune disorder. Many of us have developed autoimmune disorders post COVID,
yeah,
and more research is being done on that, thank goodness. They're not all the same. I have ankylosing spondylitis, which is similar to like a rheumatoid arthritis, but it attacks my spine and my hips and my pelvis. So I'm in pain 24/7. That is, thank God I have a high pain tolerance. It gets on my doctor's nerves because, when they ask you that 1 to 10, they look at me and the nurse rolls her eyes, because she's like, I know you're going to say 3, where if your 3 is my 11, so yeah, it took me about 3 years to even go to pain management, because I just thought, okay, this
mhm,
is what it is. And so this is what I expected. But trying to think, I can't remember if it was my rheumatologist or my primary who suggested pain management, because they're like, it'll make a difference. It's
yeah,
not just because I'm like, I don't want to take another pill, but they were like, it's more to it. And so
yeah,
recently I've had 2 spinal ablations to help with the pain. And even today, with it being rainy, I'm achy, but I was like, I'm really not hurting. And I think today's the first day where I was like, it really hit me like,
this is
I'm not really hurting.
yeah,
I'm achy, but it's not too bad.
yeah,
But yeah, so my day does consist of making sure I take medication. I developed nerve damage and nerve issues, and so I do take a medication to help with that. I've had 2 surgeries to help to keep the nerve damage from progressing in my hands.
mhm,
There are a lot of things I'm trying to remember. Like, you just get so used to it.
yeah,
I did develop asthma. In the beginning, I was on 3 different inhalers. Now I'm just down to a rescue inhaler. So that has gotten better,
yeah,
which is good. I deal with tremendous fatigue.
yeah,
to deal with that. I'm learning to pace myself, which
Mhm.
is very hard because I'm front of
Yeah.
get up and go to bed. I'm go 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 go, and so
Right. Yeah.
just making myself sit down, and sometimes just because I was used to being in the classroom or social services, I'm used to noise.
Yeah. Yeah.
And so when my girls are at school and my husband's at work, I even have to force myself to be in silence because even watching TV is comforting and, it helps to pass the time. It still causes fatigue. And I had to learn that too.
Yeah.
Reading, which was a hobby of mine since I've had COVID. I used to read probably a book, one or two books a week.
Mm.
And I will tell you, since having COVID, I have read maybe three,
Wow.
cover to cover.
Yeah.
And to me, it's a big thing because
Yeah.
it's hard. It's hard
Yeah.
because I have to keep going back. I deal with a lot of brain fog
Mhm.
and cognitive issues, neurological type issues. So I'll read a whole chapter and go, I don't know what I just read. And I have to go back and read it again. Or I just get so tired. I get a page and now I have to close it because I'm tired.
Yeah.
So daily, again, like you said, every day is different.
Mhm.
Some days are just, I'll let my husband know it's a LC day. And so he already knows, like, okay, that means he has to handle dinner. So whether that's him cooking or ordering something, don't
Mhm.
even ask me, please.
Yeah.
Like you and the girls figure that out. I
Yeah.
may not even want to eat. I may just have a snack or something. I keep little snacks to try to, protein and stuff. I drink a
Mhm.
lot of water, electrolytes and stuff. But yeah, it's very different. My
Yeah.
my day to day now is very different than it was 4 years ago.
Yeah. Thank you for sharing that. I think that is very eye opening. And I know that you and I talked about this, but you said that, you've noticed that as you've spoken openly in different settings and been involved in advocacy, for people with long COVID. And you say you often, when you start explaining what you've been through in your situation, that people say they either realize or remember that they know someone who is also
Yes.
dealing with this.
Yes, at the conference, I didn't know what to expect from the
Mhm.
conference. I mean, I've been to conferences before, mainly education or
Mhm.
things along that line. So I wasn't quite sure what to expect. But when I tell you, like, we had met a young lady who had been diagnosed with long COVID that Friday. The conference started Sunday, and
Mhm.
she was like, I'd already paid for it. I was going to come. And she
Uh-huh.
said, I knew nothing about it. And she came to our booth, and then you know how much information we had.
Right.
We were able to give her information, but also community.
Mhm.
And I don't know how many people came up and said, well, what is this long COVID? Some people that didn't know. And then once we explained, they said, I think I'm dealing with this. Or, I have a sister or a friend or a cousin. I exchanged information with so many people that said, I had COVID and I am not the same
Yeah.
afterward. And one of the things that I do want people to understand is long COVID does not mean that you are disabled like some of us, like myself, have become.
Mhm.
Long COVID does not, and don't compare yourself to other people because long COVID is more than just then yes, it can be devastating and disabling, but it may not be everything that I deal with. If something is different with you after you have had COVID, then you could have long COVID. Long COVID is an umbrella term. It's really an
Okay.
umbrella term because
Yeah.
there's just so much that falls up underneath it.
Yeah.
And so don't discredit what you're dealing with because you're comparing yourself to someone like myself. It could be whatever. If it's something that's changed how you deal with things on a daily basis, then you could have long COVID and you deserve to have someone listen to you and if it needs treatment, be treated for it. You don't have to suffer in silence.
Yeah. So thank you for sharing that because that's a perfect segue into kind of
Sorry.
like my, next kind of question or point because, you know, as the person you described yourself as someone who's always caring and giving, and you've demonstrated that kind of like in your early career and your choice in work. And I think that right now I kind of thinking about how can we help you and others like you that are, like you said, no one needs to suffer in silence. But you found some really important support groups, and there's one in particular that I know is near and dear to your heart.
Yes.
So I want to
Yes.
talk about that one a little more, because that also kind of strikes a chord with me, because in my consulting work as an epidemiologist, we focus on supporting BIPOC organizations, so Black, Indigenous people of color, not only from my own personal lived experiences, but that is really and truly where the heart and soul of everything that we do in my consulting world is. When we pour into those communities in particular, then we feel like that's like the jumpstart that helps. So it amplifies, the results are amplified. So tell me a little bit about the group that is so near and dear to your heart, and how the types of support that you're able to receive there.
So I found community on Facebook, and there's a group for BIPOC women that have long COVID on Facebook. And in that group, I met a woman, a phenomenal woman, Shamir Sweeney. She was Shamir Smith. Now she is Shamir Sweeney. And she has created the Black Long COVID experience, because when it comes to public health and like COVID, or just in general, when it comes to medicine, sadly, when it comes to research, when it comes to testing, Black people are left out, and people of color were left out of the research. And how can you say you have full research when you don't have us included? And our bodies may function different, we may react differently. And so, this magic drug that you have may not work for us because we weren't included in the studies. And so that's one of the things that we have been fighting for in the BIPOC community. And Shamir has been a trailblazer in the long COVID community, tireless. I don't know how she does it, because I know, like, after this podcast, my daughter will be getting off the bus, but my mom is here right now. And so my daughter, she'll come in and she'll see, okay, mommy's in the bed. She may throw on her pajamas and lay in here, but I'm pretty much done for the rest of the day. But anyhow, Shamir, she has a passion. She was a teacher. She taught high school, I believe, in Baltimore. And so she has a passion for people, for Black people, and she wants us to be included. Her biggest thing is that we're at the table. And so her organization is something that's definitely near and dear to me, because I know that it's going to make a difference. I know that it's going to help people. And so that's even though it's her baby, I guess you could say, if it's her baby, it's my niece and my nephew, because I care about it too. I care about it that much too.
There's two things I want to do. It definitely will make sure that we have links to her website, because it's a 501c3, so it's a nonprofit organization. And I'm going to ask my community, our listeners, to support this organization in whatever way that they can. Of course, donations are going to help tremendously, but we have a community of public health professionals that may be able to support and offer support in a variety of different ways that maybe Shamir has not even thought about. So I want to make sure that we are connecting this very important resource. We'll also include links to the Long Harbor Project advocacy group that I met, that you're at the
Yes,
booth.
yes.
But I'm really, a little biased, just because everyone knows I'm very, very passionate about serving and supporting BIPOC organizations. So I want to make sure that these resources are available, so that, like I said, our community that can start to connect, provide support, especially when we think about the leaders. Shamir is leading, and she's also suffering, she's got long COVID. So
Yes.
she's doing the work and she's exhausting herself. And I think that those of us that are, it doesn't mean that if this is not your niche area, you don't care. There's all sorts of ways you can support, but let's rally around an organization and a cause like this. And every single person that's in the public health profession had some hand in in some aspect of dealing with the COVID pandemic, from the contact tracers to the
Yeah.
researchers to all of us were involved. And we don't want to move on as if, people who are suffering with long COVID are just, like we can't forget them. So this is an opportunity for our public health community to really come together and rally around and wrap our arms around and support the causes that are out there and the organizations that are out there trying to do the good work. So make sure that we have those. The other thing I want to do is I'm going to work on trying to get her onto the podcast, and maybe we can chat with her directly as
Yeah.
well.
Yeah, I told her about you after I met you. I was like, I met this lady at this conference and she's amazing. And then, so I talked to her about you because we definitely, again, we've all met because of one, we were all long haulers, but we also make sure that we inform each other when there are things happening to make sure that there is a black face
Yeah.
in the room.
Yeah, that's important. And I want to see what we can do. I want to talk to her and I want to see what we can do as a consulting organization. I get, an epidemiologist, how can we help you in this cause? So putting it all out here on the podcast for accountability. But no, that's just really how I feel about that. And
Thank you. That means a lot.
yeah, you've had this, like you said, it's in your DNA to care and support. I think we're those of us that choose these types of fields, social work, public health, we have that heart. We are wired that way. So I feel very strongly about, rolling up my sleeves and being able to help in any way that I can. So we'll see. This is going to be a to be continued. I have to let the audience know what we decide to
Yeah.
do and what comes up. But yes, I want, as we kind of wrap up, I just want to say thank you for taking time. I always thank my guests for taking time and being on the podcast, but even more so because I know what it costs you. And this is going to be,
Thank you.
this is the rest
Thank
of the day.
you.
You got to be recovering. We're, kind of resting from this. But I appreciate that you, took the time to chat with me and to share your story on our podcast. And I'm just excited to know you and see where I can show up and be a resource for you in the future as well.
Well, thank you. Thank you for taking this time to help give a voice to long COVID. And another thing is people are still getting long COVID. COVID's still here. It's still
Yeah, yeah.
here. And people are being diagnosed with there are new cases of long COVID, you know,
Yeah.
daily. And so just thank you for letting being a platform to be a voice because like we were saying, so many people, even if they're not physically dealing with long COVID, they have a coworker, they have a
Right.
friend, they have a family member who may be experiencing it and they may not know how to help them. And so thank you for, having this platform for me to be able to talk about it. And again, for the biggest reason, the reason that I started advocating for long COVID is because I was very alone. I was very confused. I felt like I was losing my mind. Nothing made sense. And even though I had a house full of people, I felt alone. And I did not want anyone else to have that feeling. And
Yeah.
so I don't mind giving my spoons, as we call it, using some of my spoons to make sure that no one else feels that way. It wasn't a good place. And if I can stop someone from being in that place or bring them out quickly, then that's why I advocate.
Appreciate you, Brooke. And we'll definitely be in touch.
Okay.